So Julie says my son's dog had surgery on a back leg with a torn ligament. Okay, so that's going to be the cruciate ligament. There's two. So cruciates is a word is cross. And between the femur and the tibia are these two really, really, really thick, should be thick and strong ligaments that are called the cruciate. One goes from the front to the back and the other one goes from the back to the front. And it keeps the femur and the tibia from sliding back on forth on themselves. So when they bend, it should just do this, open, close as they're flexing, extending, and it shouldn't be sliding. So when that ligament becomes weakened, and it can become weakened because there's inflammation, and this inflammation is one of the things that we can find earlier in life. There's always inflammation in the joint before that cruciate tears. And you may not even know that there's a problem. The dog may not be acting lame at all. But this is one of the things that we find on this early hair mineral analysis testing that I do. And I had the research that was published on these 564 dogs that we had in this assessment of their graphs and their values. So early on, this inflammation can be there. And we'll go through this in detail during that post-summer course. But this torn ligament, it all boils down to a long time of not having enough calcium and magnesium, and then the stress. So you say he still limps some. And certainly, so the question there would be, how long has it been since surgery? And did you do any rehab? So if he hasn't gone through any of the exercise programs, you want to stay on board. Tomorrow's program is going to give you a lot of tools for helping with that. Certainly, nutrition is a big part. I'm almost to your last part of your question here. Nutrition, getting that calcium and magnesium on, or improving. This is why, and I'm sure your son was told, 65% of the dogs within 3 years will tear the other knee's ligaments too. Why? Because you didn't do anything different. The first one already happened. And that's telling you that something has taken this very, very strong ligament and shredded it. It shouldn't ever. It knows that it lives in this constant motion, and it has stresses put on it, but it is very thick. It's designed to be durable. What made it not be durable? The lack of the right nutrients in this chronic inflammation. So sure, if you don't do what created the tear in the first one, it's going to happen in the second one. And this is where also the chiropractic adjustments to help improve the body. So we know now there's been some compensation and some shifting. And so as the dog couldn't stand on this leg, it was standing on the other leg. There's going to be some curvature of the spine. So a lot of the different programs in the next few days are going to give you examples of things that you can do to help reverse some of these changes that's happened. And definitely nutrition is a part of what's going to stop that other leg from tearing. And then within 3 years, you're spending that same amount of money again. So we want to try to prevent that if all possible. And certainly, yes, the laser would help. So you can use that laser over this knee joint, and also you want to do it on the other one, because we know that there's inflammation on that one too. It just doesn't happen in one spot. So you want to go to the link for the revitavetlaser.com. That would be your link for purchasing one of the low-level lasers. Yeah, and it's a very simple thing to do. You can put it on the auto program, and it runs through all of its settings. There's 7 different settings, or you can program it to just do different tissue levels. It comes with a guidebook. In fact, you actually have one of your free books that you downloaded was that helps give you some more information on those laser pads that you can use.
Are you regularly feeding your dog but they always appear to be hungry? Find out what to feed your dog by watching this next video.